Mark Twain once said, "Figures don't lie, but liars figure." And the U.S. Chamber of Commerce, along with the American Medical Association, know how to make figures lie by falsely promoting untrue facts. But the AMA's own award-winning Journal of the American Medical Association published an article with the real story, the real facts, on healthcare-related and medical malpractice lawsuits, and they're shocking. 106,000 patients die each year from the negative effects of medication. Another 80,000 patients die each year due to complications from infections incurred in hospitals. 20,000 deaths per year occur from lab misdiagnosis mistakes and other hospital errors. 12,000 people die every year as a result of unnecessary surgery. 7,000 medical malpractice deaths per year are attributed to medication errors in hospitals. That's 225,000 deaths each year due to medical negligence of some nature and healthcare-related mistakes. And that number is growing. Today, the Insider Exclusive goes behind the headlines to examine how one well-known national medical laboratory, Quest Diagnostics, made a near-fatal mistake by mixing up a biopsy sample with that of another patient. That major mistake caused an 8-month delay in receiving life-saving treatment for Maria Rapio for a deadly cancer, a high-grade sarcoma, which is a malignant and aggressive tumor. The lab's inexcusable error changed the once vibrant, active Maria forever. During that critical 8-month delay, her infection spread to the bone, so the doctor had to put in a metal rod in her leg. She suffered from an infection from this procedure and was hospitalized for over a month. Now her leg has been left severely deformed, and she has to constantly go for checkups to make sure that the tumor has not spread. Had the correct diagnosis originally been given, she would have saved these precious 8 months, which with this type of tumor could be life-altering. Today, the Insider Exclusive shows how Maria's lawyers, Stuart Greenberg and Mark Stone, partners at the law firm of Greenberg and Stone, are getting justice for Maria. They have seen many patients suffer needless injury, and because of that, they are driven to help people who have been harmed by incompetent and negligent healthcare professionals. Their goal, not only to get justice for Maria, but to make medicine safer and more accountable. Just like Quest Diagnostics publicly states on their website, honesty and integrity are the cornerstones of our corporate philosophy. We strive to do the right thing when it comes to caring for our patients. Hi, I'm Steve Murphy, and this is the Insider Exclusive, live from Miami, Florida, at the law firm of Greenberg and Stone. It's my great pleasure to introduce Stuart Greenberg and Mark Stone to the show. Welcome to the show.
Thank you, Steve.
Nice to see you.
Tell us a little bit about your firm. What type of practices does your firm get involved with?
We handle cases involving people who have been seriously injured or who have lost loved ones through negligence of others.
Like catastrophic cases and that sort of thing?
Correct.
You have 6 offices, don't you, in Florida? Where are they?
We have offices in South Florida, Central Florida, and in the Panhandle.
Okay. I always ask this of every lawyer that we have on the show. Why did you become a lawyer, Mark?
I became a lawyer. My father was a judge and was one of the youngest judges appointed by the governor at that time to become a juvenile court judge. So he made his mark in the law and had an older brother who went to law school, and I thought that that would be something that would be challenging and rewarding.
How about you, Stuart?
I like working with people, and in our practice we get to spend a lot of time with our clients over many years, and over 31 years we still have relationships.
The case we're going to discuss today is kind of an unusual case because it's a misdiagnosis case, not necessarily by a doctor or a hospital, but by a lab.
Correct, a national lab.
Yeah. Can you tell us a little bit about this case?
Sure. We represent a lovely 60-year-old lady who you'll get to meet. And she had a small little bump on her leg, went to the doctor decided to excise it, to remove it, sent it out to Quest Laboratories locally here in South Florida, and came back that it was fine. And that was in October of 2007. In May of 2008, she was called by the doctor and told, listen, the lab thinks they made a mistake and they mixed up your specimen with someone else's. And they had to take another sample from her leg, and she came back having a very, very aggressive form of sarcoma, cancer.
How would they have known that they misplaced or mixed it up?
It's interesting you ask that. We're trying to find that out now through discovery. Probably what happened was the other patient, who was told she had cancer, was eventually rechecked and they found no cancer. We don't know who that patient is. We don't know if she understands the whole mix-up or not.
Right. You don't know because they won't tell you?
They won't tell us, that's correct.
It would seem to me that they would want to clear this up, right?
Well, it would seem to anybody that they would want to clear it up. What they're trying to do is hide the ball.
Yeah. They're trying to hide their mistake.
That's correct.
So she had another biopsy done, and what happened?
As a result of that, unfortunately, she had to go major surgery in her leg, where they actually inserted a steel rod in her leg because of the extensive injury from the cancer. And that became infected. She later spent a month in the hospital, and she has a resulting horrible scar. She's in pain. She's at risk for cancer for the rest of her life, where she wouldn't have been otherwise. And she can't work any longer. So she's really incapacitated. She's a walker.
The 8 months that she thought she didn't have a problem with her leg was gradually getting worse, wasn't it?
Yes, it was.
And as a result of this delay of 8 months, what is the damage that is done to her?
Well, had this been removed properly and diagnosed properly, she probably would have never needed the insertion of the steel rod. She would have never had the infection. Her risk of future cancer would have been much, much, much lower.
Yeah.
And she would probably be back at work and being a grandma and a mom and enjoying life.
Mark, tell us a little bit about Maria herself. What kind of woman was she prior to this horrible incident?
Maria is and was and still is a very unique woman. She's a warrior. She's a fighter. She's got a zest for life that really is uncommon. You don't see that in a lot of people. She's self-made. She's a beautician, runs her own business. She's been a successful person. Unfortunately, this injury, which was completely preventable, has taken just a tremendous toll on her life, from a physical toll to an emotional standpoint. She was a woman who would go out. She would socialize. She loved life. That has been literally ripped away from her at this point.
Right. I understand, Stuart, that she raised 4 kids.
That's correct.
Basically by herself, correct?
Correct.
She originally came from Italy?
Correct.
As a result of all this, she can't work now, can she?
She cannot work, and she really has trouble taking care of herself. She needs help.
Let's bring on Maria and her daughter right now. It is my great pleasure to introduce Maria and Elizabeth to the show. Welcome to the show.
Thank you.
Take us back to that day, Maria, when you learned, well, when you initially discovered there was a bump on your leg. You went to your dermatologist, right?
Yes.
And your dermatologist took a biopsy, correct?
Yes.
Sent it to the lab.
Yes.
The results came back soon thereafter.
Very good. Everything fine.
Very good. Everything fine.
No problem.
But then what happened?
What happened? After that, they're still growing, and I go to my doctor. I say, "Don't worry about it. Everything is fine." Okay, I don't worry. So after 7 months, they call me urgent. You know.
Had your leg been looking worse and worse?
Yeah.
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 Had you been not able to walk as much?
No. Yes, I walk. Yeah,
Still able to walk around?
Because my mind is everything fine. It's
Yeah.
some pimple there, they go away, that's
Yeah.
it. So when they call me emergency to see the doctor, and I go, and he told me, listen, we have to make another biopsy.
But here's my question. Why did he call you in
because
if they didn't know anything at that time?
Because the laboratory, they told them they make a mistake.
Yeah.
Because after when I have all these things, everything come like a dream. You know, you go, they say, I go Saturday to see the doctor, and they blow me my blood. After that, I go, they send me to the specialist from the legs, and the doctor saw me that day, they make a radiography.
Yeah.
Radiography. And they say, okay, tomorrow we have
X-ray.
X-ray.
Yeah.
Tomorrow you have to stay in the hospital, you have to go to the hospital, we have to open to see what happened there.
Right.
I said, well, but I never expect what happened to me.
Did you ask the doctor? Said, well, why? What's going on?
Well, yes, they said, no, don't worry. Look good.
Did you go with him?
I go with my other friend.
Okay.
Very good friend. So next day, that happened Saturday. Monday, I got that doctor, and Tuesday they make me operation. Oh my God, terrible.
From one day to the next.
But they told you they need an operation. Why?
Because they want to see what is there, but never told me a big mistake they make in laboratory.
They haven't told you yet.
Nothing. Even I don't have in my mind too.
Seems kind of odd. Your doctor's saying we need to operate it, but we're not going to tell you why.
Why? They don't say nothing to me.
Yeah.
No, because I don't know.
There may have been a mistake,
they make, you know, they cover each other, okay?
Yeah.
So after that, I go to see the guy, the doctor, they operate me.
Yeah.
He told me to go after 7 days, and I go there. And it's not, he don't see me, the doctor, but the guy, the assistant, they say, oh, everything look fine, but now when we call you, in case we call you in 3 days more, because they need like 14 days for send again the laboratory to see everything fine. And we don't call you because everything's fine.
Yeah.
But when we call you, you come right away. They call me. And when I go there, but I never in my life, I expect they say to me what they told me. When I go and the doctor, he sit me, even don't prepare me. They not prepare me. I go with my friend because, you know, she's with me all the time.
Yeah.
And I sit there, they say, what happened, doctor? Is everything okay? I say, no. They say, you have cancer like that. Oh my God. After that, say what? You know, and I'm sorry. I saw my friend. She start to cry. I start to cry. I said, doctor, what happened now? Why you have cancer? You know, they take me a little things like 7 months, 8 months ago, and now they say I have cancer. Say yes, but I can't tell you anything else. You have to go to the specialist now for, you know, I don't know the name in English for people with cancer. So they send me another doctor. When I go another doctor, Mercy Hospital, he don't make operation. So when I go there, and I go with my friend because she's married with a doctor, and she know all the things, you know, I don't understand. And when I'm sit there, I say, what I have to do now? They say I have cancer. I say, hey, you have cancer. You're lucky. They told me that doctor. I said, what? I'm lucky. Said, yeah, because they give you test another person so you don't suffer for 7 months. I said, doctor, you tell me now I'm lucky? I have cancer. I don't know what happened to my leg now. I said, I don't want to see you no more. I want you to send me the specialist, the most important specialist. I want to see my legs. What happened? So after that, I go to the specialist. Dr. Pitcher, thank God, good. When he saw me, I said, oh my God, something that can resolve you and nothing. Now they come big operation. You want to see my legs? They make 4 operations. Look at that. Look at that. I mean, and 9 months I can walk. Suffering.
You have a metal leg, a metal
I have
rod
a metal, yes.
in your leg.
Something, nothing. The big mistake they make with me. They destroy my life because I am very nice person. I mean, I work,
Sure.
I dance, I love family, I love my grandchild. They born the same month when they make the big operation for me. I mean, and after that, what I suffer in the hospital, infection, a lot of things that happened to me.
Yeah.
And, you know, what happened to me now?
Yeah. Elizabeth, how have you seen your mom's life change over this period of time?
Drastically. As she said, she's always been a woman that takes very good care of herself. She goes to the doctor, checks up, and if this would have been dealt with appropriately from the beginning,
it wouldn't be as bad.
We wouldn't have had any of this happen.
Yeah.
It would have been treated as a precancerous cell usually gets treated, and she would have continued living a normal life. But due to this mistake by the laboratory,
yeah,
it's changed our lives completely. I mean, I was pregnant 5 months when this started.
Mm-hmm.
My son was born, like she mentioned. She had a surgery a week later, and it was just downhill from there. 5 surgeries later, she got an infection in the hospital. She can't, you know what it is to sit in a chair for 9 months with one leg up? I mean, we had to fly family in from Italy to help us take care of her because it was too much. You know, her sisters took turns. The expenses have been astronomical. And just the family, the whole tradition of our family has changed. You know, she is not able to be that mother who made Sunday lunches for the family anymore. She can't go anywhere without, you know, the walker or wheelchair or some sort of electrical device to help her.
Mm-hmm. And you have to use this walker all the time, right?
Yes.
What do you miss most about your life before?
My life before, like my daughter say, family. I love to dancing. I can't dance no more. I used to have a normal life, beautiful. I'm a very happy person, a lot of friends. We go out. I used to have boyfriend. After that, I said no more because I can give satisfaction with. I mean,
self-esteem.
My self-esteem is down completely.
Yeah.
So.
What do you see as justice for your case?
I don't know.
Well, at this point, I mean,
I want.
You got huge medical bills, don't you?
Medical bills, her lifestyle's changed.
Yeah,
she cannot work.
Anymore,
right?
She is a
No,
very
I
active
can't.
woman,
Yeah.
always had
I
her own
can't.
business.
I have a lot of debts
Beauty
now.
salons now are full of debt.
Yeah.
You know, we all have to pitch in to try to help the light bill and the mortgage and
And
just
the mortgage and everything.
some sort of
What has been the response
relief.
of, it's Quest Diagnostics, but what has been their response for this whole thing?
Absolutely none.
Because on their website it says we really care about our patients. Do you believe that?
I don't believe nothing. Nothing. They're liars.
They're liars.
Big liar.
Uh-huh.
Big liar.
This question is for both of you. If you had a message to send to the people who made a mistake, Quest Diagnostics, what would that message be?
Get your infrastructure in order and don't make these kind of mistakes because you ruin lives every time you do.
And every time they make some big mistake, and you say you can never trust no doctor and no laboratory. You try to make 3 times the same things laboratory, 3 different times because they make big mistake. I'm not alone. Many people, they are down. For mistake, they make all this laboratory. Big mistake.
I want to thank you both for being on the show. This message is going to get out, and it's our best wishes for you. Well, when you hear it from the horse's mouth, Maria really says what she means. This is a terrible case. How are you pursuing this case? What are you doing to win this case? What's your strategy?
We're trying to show how this administrative error took place. We've taken the deposition of the president of the local Quest lab, who really had no idea how the operation even works. Mm-hmm. And now we're trying to allow, the court has ordered us, given us permission to go in and film how they process over 15,000 samples a night, and they've appealed it. So once we win that appeal, we're going to be going in there and showing how this error occurred.
Because once you have that information, you can kind of, and it's a national laboratory. They process a lot of biopsies and all kinds of tests, and there's bound to be some errors, but some of these errors can be fatal, near fatal.
Well, this one could be, yes. And this is not a mistake where a doctor misread a slide. This is a mistake where somebody took a sample and put the wrong name on it and the wrong number on it.
Yeah. Now, you haven't been able to get that other incorrect biopsy. Well, you have the incorrect one, but you don't know who it belongs to, do you?
No, we don't.
And they won't give you that information.
No, they won't.
In other words, they're not being helpful to try and correct the mistake.
That's correct.
Which goes against their website theme, which is we care about our patients and all this other good stuff, right?
Yeah, absolutely. And that's something that we're willing to address, and that's what we're doing now. We're going to look under every stone and pursue this however we need to prove that really what happened here was just a preventable mistake really not a medical negligence mistake. It was an administrative error that should never have taken place.
Just own up to it and take care of the medical bills, right?
And pay her for her lost wages.
And pay her for her lost wages, because she can't work.
She can't work, and her pain and suffering.
Yeah.
And you could see that she's going back to doctors every 6 months. She's got a fear of the sarcoma spreading and killing her. And her whole life has changed. She needs modifications to her home. She can't get up and down the stairs. The tub, getting in and out of the tub is a chore. So there are many things that need to be changed in her life and in her home as a result of this.
You know, in the medical industry, there are misdiagnoses all the time. How do they normally occur?
Well, there can be several causes. Usually it's just plain simple carelessness. The vast majority of medical mistakes that we've encountered in our personal practice, in our professional practice, just very preventable type of things. Not reviewing patient histories, not reading labs correctly. Simple mistakes that really, unfortunately, can have tragic effects on their patients, our clients.
Well, thank God you're representing Maria, and I want to thank you, both of you, for being on the program today. You're doing a terrific job. Thanks for joining us. You can get more information about our guest and the issues at InsiderExclusive.com.